All right. Well, welcome everybody. I'm Dawn Ellison. I am a member of the core group of Healthcare Reinvention Collaborative. And my co-hosts today are Lonnie Hirsch and Denise Wiseman, co-founders of HRC. The format today is will be familiar for those of you who have joined us for our events before. We're going to have an interview, and then we're going to go into breakouts, and then we're going to share something that we learned from the breakouts, and then there'll be a little bit of Q&A before we go into collaborative conversations after the first hour. So before we get started, my hope is that people remember that on this day, 23 years ago, and the weeks afterwards, we hugged our children a little tighter. We reached out to our loved ones and let them know how much they mean to us, and we united in our communities to support each other. My hope is that we remember we cared deeply for each other in those times, and remembering that, we do so again. At any time, if you would like to share your contact information or resources you found valuable, please feel free to do so in the chat. Our topic today is diversity, equity, inclusion, and belonging. We in HRC recognize that to facilitate and support the reimagining and reinvention of the current healthcare system to a future model infused with health and care that represents everyone, we will need to tap the collective intelligence and contributions that come from diverse perspectives. We have great people joining us for events as members and in our core group, and we also recognize the need to become more diverse. We want to be diverse in all the ways the US is diverse: gender, ethnicity, age, sexual orientation, culture, socioeconomic status, occupation, and thought. The question that we're discussing today is, how do we get there? So I'd like to introduce our guest, Dominique Grimes-Medlin. Dom is a seasoned HR DEIB consultant with over a decade of experience, currently partnering with Performentor and the Equity Paradigm to drive organizational success through inclusive people strategies. With extensive cross-industry experience and a SHRM certification. Dom specializes in examining policies through a DEIB lens, ensuring equitable hiring practices, and advocating for second chances, as evidenced by his statewide initiative, creating a directory of justice-involved friendly employers in North Carolina. His commitment to diversity extends to his board service, including as vice chair for Step Up Durham, where he's raised over $270,000 through annual impact events. Originally from Indianapolis, this fashionable city boy is known for his extensive hat collection, love of red wine, and dedication to fostering inclusive environments where all can thrive. Dom, welcome.
Thank you, Dawn.
So Dom, as I stated at the top of the hour, we're really trying to be more diverse. And I know these questions are tough and there may not be any one answer, but how do we attract diverse perspectives? What can we do to attract diverse perspectives?
Well, first off, thank you for the opportunity to address the Healthcare Reinvention Collaborative today. As we discussed how to attract diverse perspectives, foster belonging, and enhance engagement, it's crucial that we ground our strategies in the realities of the healthcare system. So let's confront some sobering realities. Like, only 5% of physicians identify as Black or African American. So while they make up about 13% of the US population. When it comes to the Hispanic population, they make up about 18%, but only 5.8% of them are actually physicians. And then women, and so they make up 76% of the healthcare industry. However, only 18% of them make up for the hospital CEOs. So these statistics underscore the urgent need of diverse perspectives in the healthcare leadership. So how do we attract how we attract these diverse perspectives to your board? I want to take a note from your website and to your mission, vision, and values, and so that we need to take a view from the balcony. So healthcare is a complex ecosystem, and our board should reflect. Your board should reflect this complexity. You need voices from every corner, and so that's clinicians, patients, and so policymakers, technologists, and so community healthcare workers. But you want to also take a step further You want to bring in perspectives from social services, education, environmental health. So like after all, only 20% of health outcomes are attributed to clinical care. So you want to be influenced by not only what's going on in the clinical side, but also the social and environmental factors as well. You want to embrace your philosophy and stuff that everyone's responsible. So this means making sure and like that you're being intentional with your recruitment efforts. So not only recruiting individuals from diverse perspectives, but actually doing your research and knowing all those historical attributions to different diverse and marginalized groups and have impacted them over the years. You want to spotlight and so like the greatness and of underrepresented communities. So look at some of your local communities and local leaders and so that are actually doing this work and so in your area. So I can talk to them. A lot of this work is already being done and so like by many different groups. And so it would make sense just to take advantage and try to gain that wisdom of where they already are an expert in. You want to highlight and so your flat organizational structure and emphasize that all voices are equal and valued and so with your decision making process. And that's mainly and so what I would recommend so as far as attracting some diverse perspectives to your board.
So it sounds like there's some things that we could do on our website that would be helpful. Is that one of the things you're saying?
Absolutely. I would also so recommend so that people actually see and so pictures of who is on the board. They want to see that with that representation so of themselves. So even if it's not necessarily the most diverse, so we still want to highlight and so those diverse perspectives, those views. And so there's more than just race or gender or sexual orientation. There's different, there's diverse lived experiences that you want to highlight and so I can speak to and so on your website as well as when you're engaging with individuals inquiring about whether or not they're interested in joining your board.
So I've heard about a diversity statement. What is involved in a diversity statement, and would that be helpful to have on our website that would, help us to attract diverse perspectives?
Absolutely. A diversity statement just simply states that you encourage and so diverse perspectives, that you will not that your selection process is not solely deemed based off of race, religion, sexual orientation, so et cetera, et cetera. It means that you're welcoming to all and so individuals, so regardless of what marginalized group they represent.
And you mentioned, that we are working towards a flat organization, and I'm not sure how much we've emphasized that in our previous events, but we do in our core group make decisions with a consent-based decision-making process for the most part. And it sounds like that would be something to emphasize as well on our website and in our events.
Absolutely. People want to know that their voices are heard and not to mention that their voice matters. So the fact
Sure.
that you have this type of organizational structure would be a huge compliment to attracting diverse perspectives.
What do you think might be some blind spots that we have with respect to how to help people feel like they belong to the organization once we attract them? Sorry, I've got a fly in here. I may swat at it a few times. Once we attract them, what are some blind spots about that we might have about how to help them feel that they belong? What would you say is the most powerful thing to do there?
Well, for one example, you have to consider that 8% of the LGBTQ community and so report avoiding or postponing needing any medical care and so or actually disclosing the fact that they're of the LGBTQ community so for fear of discrimination or disrespect. So to foster belonging, so you need to walk in that person's shoes. So and if you can't necessarily walk in that person's shoes, and so from your individual perspective, you just have to be inquisitive, be curious, and so ask questions. And so I promise you a lot myself, and so being of the LGBTQ community, I welcome questions. It's I am not fearful, and so of anyone asking if they may not understand or may not necessarily know all of the historical factors, and so that being of the LGBTQ community and so in the healthcare systems that might have impacted. So you want to spend time in various healthcare settings. You want to garner a firsthand experience and so of the challenges faced by these different communities. And then you want to rotate and so like leadership roles and stuff within your board. And so like you want to ensure that diverse voices are being heard and valued from different from the different leadership roles within your board and also within the different committees. You want to keep your messaging very simple, keep lines of communication so like open, and just be mindful of the communication that you're contributing to your board and so and how that may be portrayed. And so like especially when it comes to a lot of us now are communicating via email or text. So like I always urge my clients and stuff to always soften their approach when it comes to electronic communication, just because naturally most of us when we're receiving electronic communication are always going to be fearful of the worst. So we always want to be soften our approach. And so when it comes to non-verbal or not in-person communication with one another.
So something that I've learned in the last couple of years is about pronouns. Can you speak to the importance of listing pronouns?
Yes, absolutely. As you can see, and so like from my Zoom room, so I have my pronouns listed next to my name just to make sure. And also it doesn't help that my name is unisex. So oftentimes when people have not met me or are not familiar with me, oftentimes people mistake me for a woman. It's like I list my pronouns just to ensure and so that people are aware of how I would like to properly be addressed. And this is very welcoming, so especially when attracting members of the LGBTQ community. I know some people may feel some type of way. And so like when it comes, because obviously this is a concept that's very mainstream and very broad over the media and politicized and so like for quite a bit, but it's not a demonizing thing to ask a person and so what are their preferred pronouns and so and you have to it's just simply takes practice and so like once you do it enough and so like it kind of just falls into place and stuff when it comes to engaging with one another.
And for those of us who are, cisgender, if we let people know what our pronouns are, that makes other people comfortable to share theirs, right?
Absolutely.
Yeah.
And
So
also keep
what?
in mind,
Mhm.
oh sorry.
Go ahead. No, go ahead.
And also keep in mind and so we're going to make mistakes, so like everyone makes mistakes and so when it comes to engaging with diverse perspectives, even myself. And so like as a DEIB consultant, I find myself sometimes making mistakes, but we just have to own up to it and so like celebrate the failures and so like create a culture that it's safe to share those challenges and learn from those mistakes.
So once we can, do a better job of letting people know that we are inviting diverse perspectives and perhaps helping, thinking of some ways to help with the belonging aspect. How do we keep people engaged? How do we keep them coming back and giving us their perspectives? Any ideas about that?
Yeah. So engagement is crucial when you consider stark disparities and so like in the healthcare system. So to enhance engagement, you want to involve all members in the decision-making process, which is another reason why I said to highlight instead of your flat organizational structure. And so that is a huge benefit instead to HRC. You want to implement and so like project proposals and systems of which members and so like within your board and so it can not only help and so like HRC, but also their individual communities and their local communities and so as well. Addressing these issues like the 40% higher rate of preventable hospitalizations so like in rural resident areas. So you want to also apply system thinking to your activities and engaging members with collaborative problem solving sessions and address complex healthcare issues. And you want to embrace conscious capitalism, involving your board and so like providing opportunities for members to represent and so the HRC externally.
Tell me more about the conscious capitalism. I'm not sure I am familiar with that, or if others are as well.
So not it's more of a way, and so like to just make HRC more visible in the community. So not only within their local communities, but also nationally, social media, spread the word. And so like, it's like about your group and what you're trying to accomplish. So like more people, I guarantee you, there are so many people that are wanting to support this effort, and so that you all are working towards that. It's like if you make a more conscionable effort to when you are engaging with partners, with and so like individuals in the healthcare field, with and so like your neighbors, your and so like with your networking events, and so like you want to make sure, and so you always have it in your basically in your back pocket, and so like to mention, and so like, hey, I'm part of this group, and so like it's the HRC, so like want to tell you about it, so like see if you might be interested, invite them to attend a board meeting, and so like see like if they might be able to offer any input, and then also be interested in potentially joining the board.
And Dom,
Great,
my ears
thanks.
perked up when you said conscious capitalism, because of course that's something that we talk about often. Within this healthcare space, I talk about it being much more on the predatory capitalism side, where profits are really over people. And we're wanting to go to the other side, that capitalism can be fine, but when it's predatory, when people are excluded. So when we're talking about exclusion here, right, we want to be inclusive. Well, conscious capitalism means that yes, we can make a profit, but we're not pushing others out in the ability for us to make money, right? And so I loved that you said conscious capitalism. It just perked me up so much. So I have to say thank you for that.
Not a problem. Yes, and so like you have to, when you're working towards a mission, and so like that has the best intentions, and make sure that you are making a conscious effort to involve everyone in the conversation, so that you can't go wrong.
Great. Thank you, Dom. And it's time to go into our breakouts now.